In order to have a diagnosis of PTSD, you need to have symptoms in hyperarousal, symptoms with intrusion, and constriction. Don't panic, I'm going to explain what those words mean. Hyperarousal is characterized by all the panic and anxiety disorders. Anybody ever have a panic attack? I would always get them in the cereal aisle, probably because there were too many choices, especially in those really, really big grocery stores, like Wegmans. Do you have Wegmans down here? Yeah. Oh, it's like the super Walmarts. So panic and anxiety symptoms come when they get activated upon exposure. Exposure means when something reminds you of what happened. And your unconscious mind can be reminded of what's happened long before your conscious mind is. And that's kind of the mystery of the trauma, which we're going to talk about in depth today. So shortness of breath, feeling like you can't catch your breath, is a symptom of panic. Dizziness when you stand up, and people might think that they have a brain tumor or something because they are dizzy. Fainting, palpitations of their heart, sweating, diarrhea, tingling and numbing sensations where they can't feel their fingertips, a little bit of, there's a word for this. We have a nurse here, is it called parenthesia? Is there any nurses here? Can you pronounce that word for me? I can read it, but I'm like, yeah, that thing where you feel paralyzed. Parenthesis, thank you. Feelings of disembodiment, where it feels like you're not part of your body, but you start to feel like you're floating away. Hot flashes or chills. Fainting, choking, chest pain. Chest pain so bad, people go to the ER thinking they're having a heart attack or a stroke or something. Trembling, their hands shaking, nausea, headaches. I know that a lot of old people need a hop turd. That's what they call it in our Irish family. Kevin's family has a lot of aunts, and they all had hop turds, but I would always see their hands shaking. And you know the difference between Parkinson's and a tremor is that if you have Parkinson's and you have a hop turd, if it's Parkinson's, the tremor doesn't stop. But if it's anxiety, then it does. If it's panic or anxiety related, a drink can stop it. This is why people become alcoholics after trauma. It's like they're self-medicating because they can't stop shaking. And the alcohol will bring it down, and it's a form of self-medication. So, and we know that that's a big problem. I don't think we're doing research here, but the alcoholic rates and drug addiction rates just skyrocket, even when people are pregnant. Sometimes during the pregnancy is when they begin to abuse, because the pregnancy, the wanted pregnancy, is a trigger and reminder. So this all is characteristic of the fight or flight response. And we're going to talk in depth about this when we have a class on the limbic system today. So in our group, we saw that very easily, the fight, the flight, and there's also fear, freeze, and fawning, which we'll talk about later. But these are all responses to trauma. Your body, to protect itself, will go on charge in one of these directions. So you can imagine if you've had trauma, Kimmy said about her rages, just going off and raging, and she'd be screaming. He's like, "What's wrong with you?" And she's like, "I don't know." But everything inside her is making her feel like she wants to, become a professional boxer. Would have been nice if you could have been paid for all that energy. But so some examples of hyperarousal would be when you go to a doctor. Any kind of a doctor can trigger these symptoms. Whether it's a gynecologist, that's probably the worst doctor, because you have to put your feet in stirrups, you're going to smell the smells, you're going to have some guy putting a glove on, and you're just going to go into the panic. Is anybody feeling that just as I'm talking about it? Okay. Even without trauma, those exams are gross. But you take the trauma on top of it, now you're talking about amping it up to the 100th power. So one gal that was my patient had successfully been able to avoid doctors. Now, you know what happens when you avoid doctors because they trigger your trauma is that you never go back to the clinic to get the antibiotic to stop any kind of an infection. A lot of women don't go back to the clinic for the checkup. They don't want to go back to the scene of the crime That would freak them out. So what happens is they never get the antibiotic, and then they end up with pelvic inflammatory disease. And then 2 years later, they learn that they're completely sterile. So there's a lot of reproductive health issues just because of the trauma. I know another girl, one of my patients had ended up with cancer, and she saw a lesion in her skin. It was actually really a bad lesion, and she saw it all the time, but thought that was God's punishment and never went to a doctor. So it's not just afraid to go to the scene of the crime, it's also, I deserve to die. And therefore, if something's wrong with me, I'm going to neglect myself, and I'm not going to get the treatment because I don't deserve it. People can choose not to have children because they don't deserve them. I killed the only baby. I killed my baby. I shouldn't have another one. Or they have fears that God's going to take away their baby or give them a child with special needs because they deserve to be punished. So it's all about the trauma. Anyway, this girl had an infection, and like a raging infection, and she could not avoid the doctor any longer, and she went in, and she describes being on the table with her feet in stirrups, and she says that I thought I was going to die. I remember being terrified out of my mind. I was shaking and crying, and I could hardly breathe. She's having a panic attack. The doctor must have thought I was crazy. I told him I didn't think I could go through with the exam, and I left his office. I wanted to kill myself. I felt completely berserk. So her panic attack is related to her post-abortion trauma, we know that, and it triggered a physiological reaction. So the trigger doesn't always happen in your mind first, it happens in your body first. And in the flashback to her abortion, she was overcome. And what does she do here? She did what she wished she had done on the abortion table, jumped off and ran out, and then sat in her car feeling like she wanted to kill herself. So in some ways, this is a traumatic reenactment with all the same chemistry, neurochemistry, physiological chemistry, only she got off the table and left. And she had probably dreamed for years that that's what she should have done. So hypervigilance is also a form of hyperarousal. That's where you're always on the alert for threats of danger. You're always afraid that if you leave your kid in a playground, that someone's going to come out of the woods and steal your child. You might be super protective of your children and afraid to leave them alone with a babysitter. Everybody's suspect because that's your trauma. Someone took the baby. Some people have hypervigilance in their pregnancies. Every little ache, every little pain, when they're giving birth, there's more birth complications, more C-sections. You know why? Everything tightens up like a hypertension. They're so stressed. And then they can't go along with the contractions, and many people feel like they don't want to let go of the baby. They don't want to let go of the baby. So this deep trauma before it can control even the birthing process later. That's why we always say, if someone's in a crisis pregnancy center and they're going to have a baby and they have a history of abortion, that's why we love the retreats. You can do that on a weekend, and then it leads to a more peaceful birth with less complications. There used to be a saying going around by some people that, you know, they needed to wait a certain period of time. You want to get people out of the state of shock, which is usually right after an abortion. When they're in a state of shock, it's a hard time to do healing, but after they've had a little sleep. But before and most people are pregnant within the year again in their atonement pregnancies, the repeaters, you know. So while they're at risk for abortion, they're also at risk for the repetition of it again. But it's an important time to get healing for a lot of reasons, and it's a lot easier to go away for a retreat before the baby than after the baby. Although we do accommodate nursing moms on retreats, and I'll talk about that because a baby can be a trigger for the rest of the group. But we work with triggers. We don't use triggers to traumatize people, we work with triggers to heal. So that at the end of a retreat, the pregnant girl has everyone else coming up feeling her belly, whereas before they couldn't look at a pregnant girl. And you know why? Triggers are all around us. We have children around us, we have babies around us, we have pregnant women around us. So when the trauma is that great, you see what happens. You have to withdraw from the world. I know one girl who quit her job, a job she loved, because her coworker who sat in the desk next to her was pregnant, and she couldn't bear to hear about a nursery being decorated, about, watching her come in, and how young moms, everything's about everything that changes. She couldn't stand it so much that she had to quit that job. So choices are made because of unhealed trauma, choices that aren't always in their best interest or along their own career path. So that's hypervigilance. And then another form of hyperarousal is the exaggerated startle responses. This is where if you hear a loud noise, you're like, and you're really on edge. Anything can make you scared and put you in a panic. Difficulty falling or staying asleep. All the insomnias, the sleep disorders can come out of trauma. And we've learned from the battlefield that if a soldier is taken off the field and given 4 nights of rest, 4 nights of rest away from the fire zone, away from the battle, that they get better. But when your bed is associated with your trauma because of sexual abuse, when your bed has an association, and then you have a condition response, and this is why a lot of people go out drinking themselves into an oblivion so that when they come home they pass out. Or just staying up all night so they don't have to go through that. So you have all kinds of things. And over time, this can resemble serious mental illnesses like bipolar disorder. Bipolar disorder, you have the manic and then the depressive, the manic and the depressive. When, and we'll talk about this as we review some celebrities like Britney Spears, but it's actually not a chemical bipolar reaction. That's what it gets diagnosed, and then you get put on powerful drugs, but it's really the sleep deprivation, the doing risky things to make you feel alive, to bring on adrenaline, or the high all night so you don't have to feel, drinking, drugging, and then the crash. And it's mostly chemically induced. So a lot of people, I wanted to put that out there because I think a lot of people are being diagnosed with psychiatric illnesses when it's really related to the trauma. You bring down the nervous system, you give them rest, you put them in a place of safety. And I think that's why a lot of women weren't coming forward for healing until they were 50. Now we have people coming as teenagers and 13, 10-year-olds, But for a long time, women didn't come till they were in their 50s, and it was so sad because they chose never to have children because they would have been a bad mother. They tell themselves that lie. And it's just sad because that they would have been a fabulous mother. They just needed healing. So aggressive behavior and irritability, that rage, the fight or flight, when you get into the fight mode, that's hyperarousal. And that's another thing that's very hard to calm down by. Somebody could cut you off in the lane and it takes you 6 hours to calm down from it because your whole body is just wired differently as a result of the trauma. We're going to talk about that tomorrow. Outbursts of anger or rage often leads to domestic violence. I know we have Rachel's Vineyard in a number of prisons. In Florida, they have a statewide program for the offenders that are on death row. And all of them have had abortions. And when they're given permission to speak about it, they talk about that might happen in teenage and then the violence that comes. And there is an instinctual response that all of us have, animals have it, to nurture and protect the young. And for whatever reason, when that bond is broken, it does open the door for more impulsive, aggressive behavior in the future because it's like a very natural instinct. Boundaries pushed over, and when the fence is open, it's open, and it leads people to the kind of thinking that not only in like postpartum psychosis, I've had patients who said they hear voices telling them to throw the baby out the window, and then the rational part of them will say, this is my baby, I love this baby, and then they'll hear a voice saying, why not, you killed another baby, what's wrong with killing this one? So a lot of postpartum depression, postpartum psychosis is linked, and I would say a lot of the crimes, which we could go over that we read about, have histories of pregnancy loss, abortion. I'll give you some of them. One of them I don't have a slide for, but you remember the Casey Kelly Anthony story everybody heard about? She killed Kelly on the anniversary of her abortion. And then she went out on this big binge and was partying. She wrote about it in her diary. And the other thing was she put the thing over the mouth with a heart on it. Like, I'm sure she loved her daughter, but she had a lot of trauma with that. And it was like a crazy case, but nobody ever allows in these public cases that piece to come out. But a lot of the infanticides are after abortion. And the treatment for it, which is antidepressants, which can create, that's another side effect, the black box warning, where people become suicidal or homicidal. It's actually from the drugs they're treating them with in many cases. And we know that about the school killings. All those kids are on drugs. Prescription drugs. I put her in here because she was considered in the news at the time she was running for vice president as the most dangerous woman in America. And I think she was only dangerous because she was the poster child for abortion. And any woman that aborted because of a fetal abnormality, which is many people, and here she gives birth to Trig, who became a trigger to that. And then her daughter Palin's in this crisis pregnancy, and so she's the most dangerous woman in America. But if you don't like the message, you find the messenger dangerous. And this is why I am actually on a terrorist fly list. Because I'm pro-life, therefore I bomb clinics, therefore I'm a threat. Can you believe it? Alveda King's on one too. And I never knew this, but every time I go through, not when you're going through security, as you're boarding the plane, they always pull me aside, they always take out my luggage, they always want to look through what I'm carrying on. And then I said to this one guy, I'm like, do I have this sign on me or something? Do I look like threatening, really? And he says, well, he went through my books, and of course I have a suitcase of forbidden griefs, and he's like, oh, my girlfriend had an abortion. Oh, this is real. And he starts telling me about all her trauma and all her depression, and she hasn't been the same. And then I said, would you mind telling me, now that we're in this personal conversation, why do I keep getting, and he turned the screen around, he says, you're on a terrorist fly list. I was like, thanks for telling me. I'll have to pack more interesting things in my bag next time. Of course, now that I'm running Grief to Grace retreats, I'm always carrying all this medical equipment that we facilitate with, all things for, back and headache machines. I got all these machines in there now. So difficulty concentrating is another form of hyperarousal. And that's why a lot of people drop out of school. They might have had their abortion because they're in med school or their freshman year and they want to finish their goals. And because of the trauma, they actually can't think right. There's other people who go on and obsessively focus only on their studies to the exclusion of everything else in their life, and they may end up with 6 degrees when they're done, and they'll be highly educated. But as long as you're running from something, that's when you burn out, because you can't stay on that high-achieving success ladder for too long without burning out. And that's all part of hyperarousal. People related to the event are considered connectors to the trauma. This is why a lot of relationships break up after the abortion. People who were going to get married and decided that they didn't want to go down the aisle pregnant and have an abortion will postpone it. It just all breaks up. A lot of marriages break up. Sights, sounds, smells related to the loss are connectors. An episode with death will always be a connector. It could be a stranger's death. Whenever there's a school shooting or when Princess Diana died, and they become socially acceptable times when everyone's allowed to grieve and go out and light a candle and people are crying hysterically. So they take an event that's sad, but then they pour all their stuff into it. This is why you see people hysterical when somebody dies that they don't even know. And you think they're closer to that person than they are their own child. Weather, anniversaries are a connector. So usually the anniversary of your abortion, and many times the anniversary of your due date would be times that people go into a deep depression. I have patients who are hospitalized, psychiatric hospitalizations, every year for many years on that anniversary season. Season would mean in the fall, they go into a deep depression and end up in the hospital. I know other people who've told the psychiatrist, They've spoken to a psych tech in the middle of the night, telling about their abortion, that they're sad. That is never allowed to be an issue for them. They said they were told not to talk about it, even in family meetings, not to talk about it. That's not your problem. That's not your problem. That's not your problem. That's pretty crazy making. When they know when their problems started and they know what they're crying about, and people won't even acknowledge that. Weather can also serve as a similar cue. It's an environmental cue. So as soon as you see snow coming down, if it was snowy on the day of abortion or rainy or a hot, hot day, anytime it's a steamy hot day, you feel this sadness because your body remembers and it's responding to the seasonal cues. And music. When people are on the table, they always play music, and then that music becomes a connector. So that same panic, apprehension, impending sense of doom when you hear music playing in a mall or wherever you go. So a lot of people will say that after my abortion, all the music stopped. They couldn't listen to music anymore. They couldn't sing anymore. They didn't, And these are all the things that come back after healing, by the way. So don't get too depressed as we're talking about all this sad stuff. Something that we've heard many times is the sound of an air conditioner or a vacuum cleaner. The loud noises can sound like the suction machine and become a connector. I've heard many times jelly can remind people of blood clots they passed after the abortion. There's also, every time you have a period, one study in Japan was showing that people with abortion had really severe PMS, cramping, all that other stuff, because the period's actually a reminder of their fertility. And when I go into my OBGYN, there's always a poster on the wall about some pill you can take so you only have it once a year. You get to control when you have your period. And I don't know how many of you saw the Saturday Night Live skit a long time ago where the woman's taking that pill, but then when that period comes once a year, they have like chainsaw and it's all stored up. Maybe I can show you too. It is really funny. During a break, we won't film that. But some triggers, other triggers of trauma, of one of my patients, pictured here, has, it's a fake picture of her, but she worked in a bank for 14 years, and she's someone who was fine after her abortion. She said that it didn't bother her at all. And a lot of people say that. And they're right, because there is a delayed reaction for some people. The ones who suffer the fastest and the hardest are ones who had previous mental health issues or any kind of trauma, which is a lot of people, and teenagers, and people with divorce, and people with any kind of trauma, so any kind of sexual abuse. They're the ones that crack immediately. Other people have more sophisticated defense styles, and they can use their intellect to put it down and their ideology to put it down. But when I'm teaching in hospitals, I'm always told by all the nurses who come up to me afterwards that their hospice is full. The people who work at end-of-life hospice, an abortion may never bother anyone their whole life till they're dying of cancer. And then suddenly they're fearful, they want to talk about it, they're afraid to go into death peacefully because they're afraid of judgment. So who knows how long? I know that for other people it's when they're going through menopause, when their daughter is the age that they were when they had an abortion, when you have the wanted child. There's all sorts of life events that can crack it open. And for her, it was seeing the father of the aborted child 14 years later when he walked into the bank to open an account. She said, I don't think he recognized me. And she recognized him, but she couldn't remember anything weird. She thought it was bizarre that she started having a panic attack when she saw him. She said she saw him go over to the counter for a transaction, and her emotional state exploded. She said, floodgates of memories and emotions came crashing all around me. I began having panic attacks. I stopped sleeping. I just lay in bed half the night and cried. This is because he came in the bank one day. She didn't connect her panic attacks or any symptoms to an abortion. The second time he came into the bank, she said, he looked right at me. I don't think he recognized me. I began having physical symptoms of cramping, and I almost passed out. I had to leave work. At this point, I knew I needed help. I thought I was going crazy. So what's happening? She's having physical symptoms of cramping. Her body remembers what her mind has blocked out, and her body is reproducing the same physiological response that accompanied her abortion, which was tons of cramping. And we see this on retreats. A lot of times people will sit there as they're talking about the retreat, they're bent over, they're holding their womb, they're rocking, and that's because they're in physical pain. They're in physical pain, so we work with the body as we're counseling people, and we change positions, we help them tune into what's happening, because the trauma is all stored in the body. And it's called, when that happens, it's called Psychophysiological Reenactment. I'll give you other examples of that. But another gal I worked with was fine with her abortion for 6 years. She was at peace with her decision. And then she had to take her dog to the vet to be put down because he was sick. And she said that she went into the vet and she scheduled the appointment. And as she was handing over the dog, she said the memory of her abortion came over her with an overpowering nausea. And she told the vet, "I have a hard time allowing something to be killed." And as she spoke those words, she actually collapsed on the floor. That's a high state of trauma, fear, feet, the fight, the flight fears. There's also a collapse, complete collapse. Your legs buckle out from under you. Have you seen that happen when the doctor comes out and tells someone that didn't make it through the surgery and they collapse on the floor? It's a complete collapse, surrender. That happened to her, and she said that my thought was literally, "You killed your baby, why can't you let your dog die?" And I thought I would throw up right there. And she describes her legs shaking and collapsing, and she said, "My brother ended up taking the dog, and when she was gone, of course I was missing the dog, but much more important, I felt like I was missing my baby." And so at work, she would be talking on the phone, she would start crying on a sales call, she'd be the most inappropriate time, she'd burst into tears, and she said that everyone there said, "Why don't you just get another dog? Like, enough of this already." And she said, and I couldn't tell him it wasn't the dog I was missing, it was my baby who would be 6 years old, who should be here with me now. And people have a calculation. They know exactly how old their child would be, and they remember that. So the sight of pregnant women, we were talking about this also. A lot of people were tearing down like pro-life displays of the crosses of this and that. Different campuses might do a display, and then another group would destroy the property and tear everything down. And even in Boston College, somebody put up a display. It wasn't a pro-life group, it was like a biology group. They put up the fetal development through every stage, and that was ripped down. Because you don't want a window into the womb to see the reality of what's there when you're trying to maintain denial. All that is threatening. And then it's going to trigger the fight response, the destroy the response. So anniversaries or due dates, I mentioned. Mother's Day is a connector, and for anybody that's working in ministry or if your husband's a pastor or your church, it's always a good idea on Mother's Day to pray for those who've lost children to abortion, miscarriage, or stillbirth, or any kind of child loss. Because the child might be here, but you're always a mother. And your body remembers that too. And how many of you are familiar with the science that's showing the stem cells of whatever child you carried are in your body years later? It's very fascinating. So your child's always a part of you. And when there's an accident of, say you were here and your son might be in Arizona on a motorcycle, and the minute there's a car crash, the mom knows it and she jumps and she has panic. Have you ever heard those stories? Because we're connected on a cellular, we share the same cells, DNA. And I guess across the fields, if he's rattled, mom rattles. So other connectors are Christmas, and I thought that might have something to do with the banning of the creche, not just as a symbol of Christianity, but what are we celebrating at Christmas? The birth of a child and all the celebrations around children. So if you have trauma around that, this is a holiday you can't stand. And you know what else? You can't go home for Christmas because there's all these nieces and nephews getting doted on by mom and dad, and all you feel is, my baby should be here. My parents would have loved this child. Angry at all the fun and wanting to withdraw and go home or hit the nearest bar and drink. These are common symptoms. All that I just described is hyperarousal.